Good afternoon. I am Dr. Shellon Bovell. I am the project manager within the Office of the Principal Recipient Global Fund Project. Of course, the Global Fund Project is a multi country response regionally. The CARICOM Secretariat is the principal recipient, and we have been able to implement the grant over the last 3 years from 2019 October 1st, 2019 to 30th September 2022. So we are currently within the confines of our final 2 weeks of this present funding cycle. The multi-country grant has 10 beneficiary countries, and our beneficiary countries, together with our implementers, who we refer to as our sub-recipients, sub-recipients collaborating partners, include the PANCAP Coordinating Unit, uh, the Coalition of Vulnerable Communities within the Caribbean CBC, and COIN, which is a multi-sectoral organization in the Dominican Republic. They implement the grants in the Dominican Republic, Haiti, and Cuba. What are some of our major successes as it relates to the multi-country intervention? In 2018, the Council of Finance and Planning met, and we received commitments from prime ministers, ministers of finance for increased domestic financing. So one of our key objectives under this present grant is increasing domestic financing, domestic allocation for key population programming. Of course, the grant commenced in 2019, and in 2020, COVID was among us. And the challenges that exist in terms of domestic resources, and even with the decline in donor funding, we are now evaluating to see where are we with the domestic resources and the increase for key population programming as we conclude this cycle of funding. To that end, we are also supporting the removal of structural barriers to the extent of bringing about reform laws for gender based violence and stigma and discrimination. We have undertaken a number of interventions as it relates to advocacy at both the higher level, because as it relates to our conceptual framework, we do work with higher level stakeholders such as the national aid programs, our chief medical officers, and the COSA ministers of health, where that high level advocacy will be conducted and has been conducted over the years. And as we look at the bottom up approach, we are also supporting interventions at the grassroots level with our end beneficiaries through the support of CVC and COIN in their various constituencies. There have been many interventions around supporting mini grants in the region. We have what is called the availability of the shared incident database, which was first developed by CBC but now is widespread among CSOs, and we're advocating for use among our governmental entities where we are recording human rights violation, how do we bring about redress, and developing programs for addressing and supporting our clients across the region. In addition to that, we continue to work towards resource mobilization. To that end, we have supported a number of CSOs across the region in diversifying their donor portfolios. So the development of their capacity in the area of proposal writing, budget analysis, developing a budget, their governance structures, and how well those structures can speak to the implementation and accountability aspect of the grant. Finally, we tailored interventions around strategic information and use of strategic information for informed decision making. Our support from the Caribbean Public Health Agency, CARFA, has been tremendous under the grant as they document best practices, as they work to support national programs developing their data management and use systems. Together with our collaborating partner, PAHO, the Pan American Health Organization, we've been able to support a number of our national programs in development and adaptation of guidelines for HIV and STIs. To that end, we have developed a number of interventions garnered to innovative, comprehensive service delivery models, which include pre-exposure prophylaxis and how well we support that in the region. NPEP, which is also non-occupational post-exposure prophylaxis. With the support of Caribbean MedLab Foundation, we've also developed HIV self-testing. We've piloted it in a number of countries, and we're also working to support governments as well as our CSO partners in the implementation of HIV self-testing. Contact tracing, index partner testing also are these are some of the innovations, some of the comprehensive services available. And through the support of FHI 360, we have developed a package of tools to continue on in the efforts of our prevention services across the region.